Today we will be talking about antifungals and antiparasitic drugs. So first let's talk about what fungus or fungi is. A fungi is typically thought of as a yeast or a mold, and it can live in the air, soil, water, or on plants. There are also some fungi that live naturally in the human body. The CDC estimates that there are about 1.5 million different types of fungi on the earth, but only about 300 can cause illnesses in humans. An infection by a fungus might also be referred to as mycosis, or tinea, or candidiasis. The infection can be local, occurring in just one spot, such as the toenails, or systemic and occur throughout the whole body, so things like meningitis. It often infects parts of the body with poor circulation, like I said before, the toenails or the top layer of skin. Fungi likes to grow well in moist environments like the mouth or vagina. And what makes up a fungus is this cell membrane called ergosterol. And antifungal drugs are effective because they interfere with that membrane's formation. The depletion of ergosterol damages the cell membrane and results in cell death. Anyone who has a weakened immune system, such as your patients who have cancer or diabetes, or people who have been on antibiotics long term, are more likely to contract a fungal infection. Antifungals are also called antimycotics, and these are the drugs that treat fungal infections. The symptoms of fungal infection will depend on the type of infection, but most commonly symptoms include skin changes, so like red and possibly cracking or peeling skin, and itching. For oral thrush, which is called candidiasis, which is a fungal infection of the mouth, you may see some white patches on the tongue or the lips or inside the mouth. And this is very common in newborns and people who have been on antibiotics for a long time. Tinea fungi most commonly cause skin infections, and I've listed some here for you to see. Histoplasmosis is a type of lung infection caused by inhaling fungal spores, and that's a more severe type of fungal infection. If you'll look on table 27.2 on page 347 in your book, it will list common antifungal drugs. So let's talk about some antifungal drugs that treat local infections. The first one treats oral candidiasis, and it is known as nystatin. And nystatin can be given several different ways. We're going to talk about the oral solution way right now. And you may see a healthcare provider order oral nystatin. It can either be swished and swallowed, or you may have your patient swish it and spit it out. The dose is typically 4 to 6 milliliters, and it's used 4 times a day for 1 to 2 weeks. For infants or younger children who might not be able to understand how to swish the solution in their mouth, we actually give an oral suspension, and we squirt it in the insides of their cheeks and kind of rub the cheek against the teeth to make sure it gets good and absorbed, and that will help treat the infection that way. Make sure you teach your patient to not eat or drink for 20 minutes after administration, and this allows the medication to absorb. If you have a client who uses dentures, it's important to soak their dentures in the nystatin solution. If you're giving other medications with the nystatin, give all of the other medications first and save this one to last. That way it keeps their medication in their mouth without them having to drink water and swallowing that medication, because we really want it to coat their mouth to take care of that fungal infection. Nystatin can also be given in a powder or cream form, and this would be referred to as mycostatin. Candida, which is the type of fungi that causes these infections that we're treating. It can be commonly found in the skin folds or on the feet or in the groin area. We also see it a lot in the diaper area of infants. As the nurse, you want to treat or tell your client to keep that area clean and dry. That way the area can heal and it prevents any future infection or for that infection to spread more. You will apply this topically as a powder or a cream, and it is applied to the area until it is completely healed. So there's not a specific time frame. We just want to give it until that infection clears up. If the person has a fungal infection in their feet, we want to make sure we dust powder in their shoes. That way we don't want them putting their feet back into a shoe where there's a fungal infection and reinfecting themselves. Lastly, nystatin can also be given via a capsule and taken by mouth, but you'll see this less commonly because it's poorly absorbed by the GI tract. Next, let's talk about azole antifungals. So these drugs are called azole drugs because if you see the end of their name, it ends in azole, so azole antifungals. These drugs interfere with ergosterol formation, and depletion of that membrane damages the cell membrane, resulting in cell death. These drugs are effective in treating local or systemic fungal infections, and they come in various forms. So you might have topical forms like shampoo, cream, powders. You might also have oral forms and IV routes. So there are several different examples, but we're just going to talk about two of them. First is miconazole or Monistat. You may have seen commercials for this or seen it at the drugstore. You can buy it over the counter, and it's most commonly used to treat vaginal yeast infections. Another one is fluconazole, also known as diflucan. This is an oral medication that can be used in place of Monistat to treat vaginal yeast infections. It can also be used for other types of fungal infections, but this is a common one, so I'm just using it as an example. So diflucan can be given orally or IV, and it must be prescribed, unlike the miconazole. Side effects for PO or IV routes include GI upset, so things like nausea, vomiting, diarrhea, abdominal pain, rash, headache, and low potassium. As the nurse, it's really important if your client is on an azole antifungal drug to be on the lookout for the yeast infection. So where is this infection located? Make sure you ask your client. Is it in the vagina? Is it in skin folds? Is it an oral infection? We need to know where it is so that we can monitor and see if it's getting better or worse. So the last antifungal drug we're going to talk about is like our big dog, very strong antifungal medication, and it's called amphotericin B. You might also hear it referred to as fungazone. And this drug is reserved for life-threatening fungal infections. So these are going to be things like your severe systemic infections like fungal meningitis. One example I have is that a client inhaled pigeon feces, and that resulted in a histoplasmosis lung infection and got the client really, really sick, spread throughout the whole body, and they had to be treated with amphotericin B. So with this drug, it has a really long half-life, so we don't give it very often. We usually only give it once a day or once every other day. And it's excreted really slowly. It takes weeks to months for the body to excrete this medication. When we give it as the nurse, it must be given slowly over an IV pump. It's usually given over about 2 to 6 hours, depending on whatever the healthcare provider orders. And thrombophlebitis is really a common side effect, so you might have to be starting a new IV in between each one of these administrations because it can burn up the veins really fast. We commonly refer to the side effects as shake and bake, or you might hear the drug, instead of referred to as amphotericin B, we might call it amphoterrible. So we'll go over the side effects more on the next slide, but just remember amphotericin B and shake and bake. Okay, so I told you shake and bake on the last slide, and that's because about 50% of people who are receiving IV amphotericin B will develop chills and fever within 1 to 3 hours after the infusion begins. So they feel pretty miserable. One way we can prevent this is by pre-medicating them with acetaminophen and diphenhydramine about 30 to 60 minutes before we start the infusion. You might also see hydrocortisone given. Other side effects would be things like flushing, so redness in the cheeks, hypotension. Their blood pressure can bottom out really quickly, so we have to keep them on a monitor and be monitoring their blood pressure throughout the infusion. We talked about watching the IV site throughout the infusion. You can advocate for a central line because it will hold up a lot better than just a peripheral IV. This medication is extremely nephrotoxic, which means it can damage the kidneys, so we want to assess kidney function. The best way to do that is by monitoring urine output and BUN and creatinine lab levels. We may need to give them extra IV fluids to help flush the medication out of their system. Hypokalemia, or low potassium, and hypomagnesium, low magnesium, are common. These can be dangerous electrolyte imbalances that can cause arrhythmias, so that's another reason they have to be on a cardiac monitor. As the nurse, we want to protect the medication from light, because if we expose it to light, it can break down the medication and it won't be as effective. So it needs to have a dark bag placed over it, and it needs to be in a dark place within the med room. For the antiparasitic class, we will talk about one drug, metronidazole, also known as Flagyl. It is in chapter 28 of your book on page 364. And this drug is unique because it's classified as an antibiotic and an antiprotozoal drug. It inhibits cell synthesis, causing cell death, which ultimately clears up an infection. There are many routes for administration for this drug. So you have oral, IV, topical gels, and intravaginal gels. It's most commonly used to treat infections in the GI tract. So things like H. pylori, Giardia, which is a parasite that comes from drinking contaminated water, C. diff, and Trichomonas vaginalis. Trichomonas is actually a sexually transmitted infection caused by a protozoan parasite, so that's why metronidazole is effective against it. You will see this drug used a lot prior to gastrointestinal surgery. There are some nursing considerations with metronidazole. First, it can inhibit metabolism of anticoagulants in the liver. So if that happens, your client might have some bruising or extra bleeding. So that would be something as the nurse you would want to watch for. They also might be monitoring their liver enzymes in frequent blood draws. No alcohol when they are taking this medication. And this is because it can cause severe toxic effects. Things like nausea, vomiting, tachycardia, and potentially circulatory collapse. And with this drug, we say it has an anti-abuse effect. And what that means is, anti-abuse is the brand of the prescription drug disilfiram. And that drug is used to treat chronic alcoholism. And when people who are alcoholics take disilfiram and then they drink alcohol, it makes them very, very sick. Well, metronidazole acts the same way when alcohol is drank. So it'll make the person very sick. It can increase the toxic effects of the drugs. So that's why we tell them no alcohol at all. Some other side effects would be things like dry mouth, headache, flushing, dizziness, metallic taste, discolored urine, it may turn a dark brown, and GI upset. These side effects should go away once the medication is stopped. With most other drugs, you want to tell your client never to skip a dose, or don't finish the drug before taking the complete course. I mentioned the Giardia parasite earlier, but we're going to go into a little more detail on this slide. So it is a parasite that comes from drinking contaminated water, and it'll ultimately cause watery diarrhea, which can leave a person very dehydrated and make them very sick. Transmission of this infection is through person-to-person contact. So if you come in contact with someone's stool that has the parasite in it, you can become infected. Unfiltered water, improperly prepared food, and contact with animals. It's the most common intestinal parasitic infection in the U.S. So as the nurse, if you have a client with a Giardia infection, you should always be wearing gloves when you're handling their stool. If you have an infant or a small child in diapers, you should be wearing gloves when changing their diapers. And we always want to wash hands with soap and water because hand sanitizer is not as effective in killing the parasite.